Hello and welcome to Make a Difference, the show about how volunteers are making a difference right here in Montgomery County every day. I'm your host, Sandy Smith. We welcome you here via Zoom due to the current pandemic crisis. Today we're speaking with Andrea Kemper-Wink, Director of Development and Volunteer Services Community Reach of Montgomery County. Welcome, Andrea.
Thank you.
Andrea, tell us about Community Reach, which was formerly Community Ministries, and the population you serve.
So we're a safety net organization that provides healthcare, housing, financial emergency assistance, education for immigrants, and elder care for the most vulnerable in Rockville and Montgomery County. And our 5 programs encompass a lot of things. So that's my main elevator speech.
How has COVID affected your ability to provide these services?
Well, we've definitely had to pivot, one of my new words, everybody's new word, in many ways. So our language outreach program, which provides ESOL classes, citizenship test preparedness classes, and conversation classes, probably made the biggest change in that they were seeing clients and students and teaching in classrooms. And obviously they can't do that right now. So everything is done online. And they've been very successful at it, and actually have found that some of that is so good for some of the students, it's easier that they will provide, after we can go back into classes, some online classes as well as classrooms where you meet in person.
You find that you will be able to reach more students that way?
Yeah, absolutely. Right. And that also avoids the issues of transportation. Can they get home from work and have time to eat and get to classes and all of that? So it helps broaden our reach.
I think a lot of businesses, as well as nonprofit organizations and just organizations as a whole, I think will find that they're going to keep a lot of the virtual methods that they've come up with to reach out to people, because you can find people everywhere, you can reach people everywhere. So that's good to hear. How have your volunteer needs changed due to COVID, and how are you managing social distancing?
Our volunteer needs haven't changed so much, but how we can utilize volunteers has obviously changed a lot. So for example, in our clinic, we use interpreters. We have Mansfield Caseman Health Clinic that provides healthcare to those who are uninsured, Medicaid or Medicare insured. And a lot of our patients are Spanish fluent and not as comfortable in English. And some of our providers are not Spanish fluent. And so we need to connect the two of them. We had interpreters who would come in and be in the room with the medical provider and the patient previously. Now that's being done through the telephone. So, if you have a patient in the room and a provider in the room and they don't speak the same language, they can get on the phone with a volunteer who can make that connection.
Okay.
So that's one of the things. One of the other ways, we've not used as many students, unfortunately, as we had previously. And we've had to be a little bit more restrictive with our volunteers. So for holiday giving in the past, we were part of the Montgomery County Holiday Giving Project, and we do Thanksgiving distribution and December distribution. And in the past, it was a place where we could bring in a lot of volunteers of a lot of different ages and get them involved. This year, because we needed to decrease the number of volunteers, obviously, we could only accept volunteers who were 16 and above, because we really needed people who could do the work on their own.
So what are your top volunteer needs? Are there specific qualifications that you need volunteers to have? Is there a target age group? What are your top needs?
So right now, there are 2 needs that are a little bit unusual, and that is, and there's something that goes on throughout the year. So from an administrative standpoint, we always look for volunteers for our committees to help with our events committee, and we have a gala coming up on April 24th. So that committee is about to ramp up. We have a development committee, a governance committee, and a finance committee that are ongoing. and are meeting virtually, where we always like to have people, and that's also one of the stepping points frequently to the board of directors. So if you're looking for a way to get more involved in the administrative side of a nonprofit, those are good ways to do that. We also have our Rockville Emergency Assistance Program, always needs intake coordinators. And in the past, we've been pretty strict. They need to be 18 and above. They need to be able to be available for 6 months. And they would come into our office for 4 hours a week, the same 4 hours during the workday, and help with clients because the learning curve was so wide. But now during COVID, we are having volunteers for that program, our Rockville Emergency Assistance Program, volunteer from their homes. They return calls that are left on the voicemail and they gather information. So right now they're really triaging so that our director of the program can help with the actual needs and not do things like find out what exactly they're calling about, getting their address and all of that. So they're basically doing the first piece, and hopefully will want to stay and come into the office and learn more when we're back in the office. But if not, that's okay too.
Right. How can volunteers contact you?
Well, you can reach out to me at my email address, Andrea K.Wink at cmrocks.org. You can go onto our website, cmrocks.org, and you can look at how to help. And there's a lot of information about our volunteer opportunities, including our drives, like cleaning supply drives that help our clinic and our houses as well.
Thank you. We've been speaking with Andrea Kemper-Wink. Thanks for joining us today, Andrea, and stay safe.
Thank you.
When we return, we'll talk with Jessica Pryor, Medical Reserve Corps Coordinator with the Office of Health and Human Services, about volunteering to help with COVID. Stay with us.
Roll over. When you adopt a shelter pet, you discover all the things that make them unique.
And your mother.
They're a little bit of a lot of things, but they're all pure love.
Welcome back to Make a Difference. I'm your host, Sandy Smith. Joining us now is Jessica Pryor, Medical Reserve Corps Coordinator with the Office of Health and Human Services. Welcome, Jessica.
Hey, thanks so much for having me on, Sandy.
So, Jessica, explain to us exactly what the Medical Reserve Corps is.
Yeah, so the Medical Reserve Corps is a national network of community-based groups of volunteers. So it encompasses medical volunteers, public health professionals, and others who want to assist their community in activities to promote and strengthen public health, both in emergency response and just to build community resilience. So right now in the COVID-19 response, they really are helping with this emergency response situation. So in Montgomery County, the unit is housed in the Department of Health and Human Services, which is in coordination with Maryland Department of Health. So this is really the premier volunteer group that we are using to support COVID-19 response here in Montgomery County.
Oh, wow, wonderful. Okay, so what types of volunteers are you looking for, i.e. specific skills or licensing? What are you looking for exactly?
Yeah, so as I mentioned before, it is kind of a catch-all of many different volunteers. So we are looking for medical volunteers to actually help with the vaccination as well as testing. So these are physicians, nurses of all different levels, the nurse practitioners, RNs, as well as pharmacists and physician's assistants. So those would be the ones that are actually doing clinical involvement and giving vaccinations and those testing. We're also equally looking for non-medical volunteers to help support these sites. So these volunteers will help with things such as client registration, helping people navigate through the vaccination site, documentation of those vaccinations and testing, and general support of those sites. So we really do need those non-medical people to help support those sites. So without these volunteers, we really would not be reaching as many people for testing and vaccination in the county. So these are essential to our efforts to help support this.
Is there a certain age group that you are targeting?
So it is anybody, you do have to be 18 years or older to join, but there's no upper age limit. We would love to have anybody 18 and older.
Okay, great, great. What safety precautions are you taking to ensure the well-being of the volunteers?
Yeah, so the volunteers really work side by side with our county staff. So they'd be getting all the same precautions and things in place that any county employee would be getting. So this includes the proper PPE. So if you're working at a vaccination site, this includes proper masks for whatever your role is, gloves, gowns, depending on how close of direct interaction you have with people, we would scale up kind of the personal protective equipment barriers that you would be receiving. So we do keep that in mind and try to keep everybody as safe as possible when assisting with this.
Okay, and you provide all of the PPE that is necessary for the at that site.
Correct. We do just ask people arrive with a cloth face covering, and then we'll give them any additional supplies that they need from there.
Okay, great. How can someone volunteer to support COVID-19 vaccinations and testing sites?
Yeah, so as I mentioned, they would want to register as a volunteer with the Maryland Responds Medical Reserve Corps. So there's a couple ways that they could find that. They can go to the county's volunteer website, as well as they can just kind of do an internet search of Maryland Responds Medical Reserve Corps. It'll be the first thing that pops up on your search, or you can go to mdresponds.health.maryland.gov. And there they'll be walked through the registration process. If they are clinically licensed medical providers, they will enter their licensure information, and this will be verified by Maryland Department of Health. And any other relevant skills that they have from any professional experience or other volunteer work, they'll also be prompted to enter that so that we can best utilize their skills to assist with the COVID-19 response.
And do you follow up to verify the licensing and all of those credentials?
Correct. Yes, we do. So Maryland Department of Health verifies those credentials for us. And so they match that with the state licensure boards and verify that they are, in fact, a clinically licensed professional.
Okay, wonderful. And approximately how many volunteers are you looking for?
So this is a huge undertaking that to vaccinate all of the county. So we are looking for pretty much as many people as would like to register. So right now we have about a little over 1,200 that have completed all of the training. And so, we're looking if we could get upwards of 2,000, that would be great.
Wow.
So, additional couple hundred, because we really do use, right now, we're using about 100 volunteers a day between testing and vaccination. And so we'll continue to expand that as more vaccines are readily available to help vaccinate the county.
How many sites do you currently have?
So vaccination, we're running about 2 to 3 per day, and testing is usually around 3 to 5 per day, depending. The vaccinations really depend on how many vaccine doses we've been allocated from the state and the federal government. So we really try to push those out as soon as we get them to the county residents. And so the volunteers kind of help us have that flexibility that as soon as some vaccines arrive into the county's hands, we can pull on the volunteers to help support our staffing and scale up and scale down depending on that number of vaccines we have.
Do you have a consistent amount of vaccinations coming in?
Yeah, so we do. So again, that's allocated from the state, and I don't have exact numbers for you, but every week the state does allocate a certain number to the county.
Okay, wonderful. Okay, could you give us that site again, the website again, that volunteers should go to?
Yeah, so it's mdresponds.health.maryland.gov. And they can also always contact me at jessica.pryor, Pryor, at montgomerycountymd.gov.
Thank you so much for joining us, Jessica.
You're welcome.
If you're interested in volunteer opportunities, please go to our website, montgomeryserves.org. I'm your host, Sandy Smith, and thank you for joining us, and let's be sure to make a difference.